All right. Good evening, everyone. It's so wonderful to have so many of you having joined us in person tonight, and also so wonderful to have so many of you joining us online via the live stream. Thank you for being with us. I'd like to formally welcome you to the Faculty of Health and Medical Sciences Dentistry and Oral Health information session. My name is Sasha Champion. I am a student recruitment coordinator here at the University of Adelaide in the domestic recruitment team, and it is my pleasure to be your host for this evening. So before I go any further with any formalities, I would like to do a formal acknowledgement of country to acknowledge and pay my respects to the Kaurna people, the traditional custodians whose ancestral lands we gather on. We acknowledge the deep feelings of attachment and relationship of the Kaurna people to country, and we respect and value their past, present and ongoing connection to the land and cultural beliefs. One little quick bit of housekeeping as well. If you need the bathroom at any point this evening, they are just through the doors at the bottom of the theatre here and to the left. So the first thing I will do is just sort of introduce you to some of the key staff in the Faculty of Health and Medical Sciences relevant to the Bachelor of Dental Surgery and the Bachelor of Oral Health. And we are very lucky to actually be joined in person here by all of these staff that you see up on the screen. So we have here with us Professor Richard Logan, who is the Dean and Head of the Adelaide Dental School. We have Dr. Jennifer Gray, who is the Program Director of the Bachelor of Oral Health. And we have Associate Professor Dimitra Lekis, who is the Program Director of the Bachelor of Dental Surgery for years 1 to 3. So thank you so much for being here tonight. So the way that tonight is going to work is we will present to you with a sort of a presentation, the information, and again, our Faculty of Health and Medical Sciences academics will help sort of share that with you. After that is done, we will move into a Q&A session. And I will invite our academic staff to be part of that panel session, as you can see, along with myself. And we are also very, very, very lucky to be joined by a few current students who are currently going through the Bachelor of Dental Surgery themselves. So we have Valerie Jung, who is a second-year Bachelor of Dental Surgery student. We have Isabel Tran, who is in their third year, and Samantha Tang, who is a fourth-year Bachelor of Dental Surgery student. So again, thank you to you all as well for giving up your Tuesday nights and being here with us. So when the Q&A panel session starts, what I will ask you to do, if you do have a question that you would like to ask any of our panel members, just ask that you simply pop up your hand and we will get a microphone to come to you. And if you are watching and joining us online via the live stream, just pop any questions that you have in the chat function. That is all for me for now. I'm going to hand over to Dimitra.
So welcome everyone. So on behalf of myself, Professor Richard Logan and Dr. Jenny Gray, I'd like to welcome you to this evening. Just to start a little bit about the Adelaide Dental School. We're the only dental school in South Australia, so based here at the University of Adelaide. We have a proud tradition of 100 years plus of being a school here, serving the community of South Australia and beyond. And our school has a dedicated group of academic staff members and researchers with our mission to serve the needs of the community and train and do sort of cutting edge research to improve the well-being and oral health of our communities. So as I mentioned, we're the only dental school in South Australia, and we offer both the Bachelor of Dental Surgery undergraduate program and the Bachelor of Oral Health program, as well as a range of specialty programs and higher research programs as well. Our students in the Bachelor of Dental Surgery program, which I'll speak to a little bit about, work in a variety of learning environments. We have simulation clinics and clinical placements, which I'll talk about soon. And so this is just a picture of our dental simulation that our dental surgery students and oral health students do a lot of their clinical practice training before they see patients, as well as also during the whole program. They will also go in and practice on sort of simulated patients like these mannequins or like dummy heads, and they sort of practice there first, and it's sort of simulated like a real clinical environment, and then they'll work on patients. And our other main facility, it was just one of the main clinical sites, is the Adelaide Dental Hospital, which is located near the Royal Adelaide Hospital in the Adelaide Health and Medical Sciences building. So the Adelaide Dental Hospital is on level 11 and level 12, like the main clinical facilities. And we'll talk a little bit about other facilities that we use for our clinical placements a bit later. So the Bachelor Dental Surgery program is a 5-year full-time degree, and it's structured with one integrated subject that runs through each of the year levels. So it's called Dental Science and Practice, and in first year it runs the sort of clinical practice, Dental Science Practice 1, 2, 3, 4 and 5. So one integrated subject where our students learn to integrate the dental sciences, the biological sciences, together with learning how to become a dentist, so the clinical practice. We have a wide range and variety of learning and teaching approaches. So one of our main approaches that runs through pretty much the whole program and starts in first year is case-based learning, so small group learning. So we have our students learn to be like dentists and learn some of the theory, sort of behavioural sciences, communication skills, working in teams using real-life dental clinical scenarios. Our students also begin working in the clinic pretty much from first year. So within a couple months of starting first year, our dental students will be in the clinic and they start off working on each other, learning basic clinical skills. And then slowly as they progress through the program, our clinical skills will become more advanced and more complicated. So we start off with basics, building up to by the time our students work in third year, they'll be working on South Australian dental patients, performing simple invasive procedures like fillings, scaling, giving dental anaesthetics. And then when they move into fourth and fifth year, they'll learn more wider range of dental treatments such as root canal treatment, crowns, dentures. They'll learn how to extract adult teeth, as well as learning how to perform children's dentistry and procedures on child patients under the age of 18. And then when our students end up in final year, that's the year that they'll transition towards graduation and practice. And so they'll work with a wide range of patients performing the whole range of dental procedures. So unlike medicine, dentistry, when our students graduate, they are job and practice ready. There is no internship. So after the 5 years of the degree, our graduates are ready to work. And just like to mention too that throughout the whole program, we scaffold our students learning in first year a little bit about the human body and health, and also students learn about teamwork skills, clinical communication skills, population oral health, cultural competency and cultural safety, and working using a person-centred, cared approach. Our students also have to be really skilled at self-reflection and sort of evidence-based dentistry as well. So that's a feature that runs across the whole, another theme that runs across the whole 5 years. And dentistry is a very rewarding and I would say very flexible career. There's lots of sort of options, and when you graduate, most of our graduates will work in either private practice or in public dental practice. But certainly as careers progress, some of our graduates go on to become specialists, dental specialists, or research, or academia like myself. So I started off in public dental practice and moved into academia and some research as well. And my sort of tip and advice for all of you who are considering careers in dentistry and becoming dentists is to really find out about the qualities that suit you in terms of matching that with the sort of what a dentist does in terms of the skills that are needed to become a good dentist. So some of those are what we help our students learn about. For example, teamwork, good communication, critical thinking, also working well with your hands and doing sort of fine motor work or fine skill work, and sort of wanting to sort of work with people and being a good and effective communicators. So that's it from me from now, and I'll just hand over to my colleague Jenny, and she'll talk to you a little bit about the Bachelor of Oral Health program.
Thanks, Jimmy. Welcome. Here to talk about the Bachelor of Oral Health program, which is a 3-year program. And there are a lot of similarities between the BDS program and the BOH, but there's also a lot of differences. And a key part that I would say to you is to really go and find out the difference between those programs, but also between the careers, because they're not the same. There are different aspects that's important to understand. Bachelor of Oral Health is a little bit different to some other degrees. We are actually quite small. We have about 30 in our intake each year, so it's a nice small cohort, and that you really get to know your colleagues and work together in a team with those colleagues. And I think that's a really great supportive environment. We get to know you really well and you get to know us really well, and that you can really see it as that early development of being in the profession. We also use the dental simulation clinic. We start in first year and we use that for about a session a week in first year, and then that steps up in second year where you're in there 2 or 3 times a week, really developing and extending your skills in that simulation clinic. Really important. It's very fine work that we do, and really developing those hand skills and understanding the differences in what you're doing is key to then going into the clinic. We do have a number of placements, and that varies across the 3 years. So similar to dentistry, you start in first year in the clinic where you're working on each other, not doing anything irreversible. You're not going to do fillings on each other, but just getting used to actually looking in a mouth. And that can be a very small place to work, and suddenly you can feel like you've got about 20 fingers. So it takes a little bit of time to develop those skills, but also to develop how you have that patient operator perspective, how you talk to a patient and how you work around this small environment, and how you work in sort of quite small cubicles in a way. So you start that in first year, and then in second year we have very long years in second and third year. So they start around about the 23rd of January, and they go right through till about the beginning of December in both second and third year. So we have a 4-week preclinical year, 4 preclinical program before we then go into clinic, and then you're in clinic 2 days a week for the rest of the year. So we need to make sure that you're ready and safe to practice, because then you're starting working on children and on adults. That's then extended in your third year where you're predominantly in the clinic, and that could be around a number of places. In the final year, we were pretty unique when we started here at the University for Oral Health Programs in having a research project included in the program. So that's in the third year, where you really get a chance to explore an area of interest and delve into that deeper, one, to understand the topic, but also to develop those research skills. As we know, information is changing constantly, and you need to develop those research skills, because that's going to be something that will be there ongoing for the rest of your career in either dentistry and oral health. So developing those research skills right from the word go, but then setting that up in a research project that can be in the area of interest that might be where you end up working once you graduate. We also work in the community outreach program. Both the BDS and the BOH have some placements there where you can work with a range of people that don't necessarily have the same access to care. So it might be people that are homeless, it might be people that are disadvantaged, and it might be people from different cultural groups that don't have access to care. And so that's a great experience for our students to be able to work in there. So this just outlines a bit of that in more detail. So the first year does have a lot of the dental sciences. Now we're different to the BDS. We don't have one course. We have 4 courses within that first year. So we have human biology that gives you a lot of detail about the anatomy and physiology that you need to underpin all of the work that you do. We have dental dental and health science. That gives you a lot of the dental and some medical aspects, dental anatomy, etc., that are important to your career. We also have evidence-based practice, again, starting those research skills from the first, and professional practice as part of that, really understanding where you are with your practice, as well as clinical practice. So again, one session might be in the simulation clinic and a full day that might be out in clinic practice. That first year has more of the traditional program with the 2 semesters with traditional weeks. Second year, that's where, as I said, you get to see the real patients. You have that strong preclinical where you need to meet a number of requirements before you can go and work on real people. And then you have a day with paediatric patients and a day with adult patients, and they're out in the community clinics. You still have human biology where you explore in more detail, particularly medical conditions and medical medications. You need to understand a lot of that in managing patients. It can be quite a complex area. And then in third year, it is predominantly the placements. And this is where you have a number across the community clinics, and they can be larger clinics or they can be some of the smaller 3-chair clinics. You also have a rotation in a rural area, and we normally have that as a 6-week rotation for the oral health program. So you get a range of experiences and you get a range of tutors in those areas, and they're invaluable in really helping guide and help you understand different circumstances. So we have a great community of tutors in both programs that are there to really help support your learning. You need to do a lot of individual learning on your own, but they're there at all times to support and help your understanding. We also in the third year have the oral health elective research program, as I mentioned. So there are lots of career opportunities. There are a lot of our graduates that work across different environments. So there'll be some that will work a couple of days in private practice, and there'll be some that work then a couple of days in community clinics or with the government clinics. Some do either. So it's a great chance to actually get a variety of different experiences once you graduate. We also do have a number of people that do health promotion. And they can do that in kindies, in schools, they can do screening, they might go into aged care homes. So there's a slightly extended scope that you can have in different areas. We also have people that have gone into policy and work in developing services, but there are also some that have gone on to do research and get their PhD. So it's a great opportunity that you can extend your learning and then your opportunities for graduation. I think that's the end of me.
Yes.
So I will hand over.
Thank you so much for that. Yes, I'm going to jump in now, and after hearing that fantastic information about both programs and sort of the experience that you're in for, I am going to take you through more of the meaty admissions stuff. So I'm going to take you through the general application process for both the Bachelor of Dental Surgery and the Bachelor of Oral Health. So starting with key sort of information and things to be aware of in this table. Firstly, for the Bachelor of Dental Surgery, we intake once every year at the start of every year in February. There is a minimum academic score that you need to be working towards, and regardless of whether you are seen as a domestic student, a domestic applicant, or an international student, an international applicant, the required scores are the same, as you can see. So if you are working towards an ATAR in year 12, you will need an academic score score of 90 or above to be eligible to have your application progressed through the process. If you are working towards completing your International Baccalaureate or your IB, the equivalent score is a 34 or above. So key things to keep in mind when you're in year 12. If you are considered an international international applicant, you will also need to meet the English language standard requirements, and one of the ways that you can do that is to sit what's called the IELTS test, which is an international English language standard test, and the score that you'll need to meet if you do choose to do that is a 7 or above. The duration, so we've already heard a little bit about that for the Bachelor of Dental Surgery. It is a 5-year program at a full-time pace, so you're here at university for 5 years. and prerequisites. There are prerequisite subjects to be aware of that you must complete, satisfy in Year 12. So for Bachelor of Dental Surgery, there are essentially 2 categories of sort of prerequisites, and you need to make sure that you are meeting, you're satisfying 1 subject from each category. So the categories, as you can see, are first one, you need to have 1 subject from either chemistry, physics, maths methods, or specialist maths. The other category is 1 from either biology, chemistry, geology, or physics. So we're not saying, again, do all of those subjects. Obviously you can't in Year 12. It's just making sure that you're satisfying 1 subject from each of those categories. So look, for the Bachelor of Oral Health, slight differences to be aware of. Same thing with the intake. We intake once every year at the start of every year in February. Academic score required is slightly different. So if you're working towards an ATAR, you'll need an ATAR, a score of 70 or above to be eligible. That's that minimum required score. If you're working towards your IB, slightly different again, a score of 25 or above is what's needed there. And again, it's the same thing, same scores whether you are a domestic student or an international student. Same also with the IELTS test. If that is something that you complete, you sit as an international student, it's a score of 7 or above that you will need. And again, it's a slightly shorter program. So as you can see, you will be studying for 3 years at a full-time pace in the Bachelor of Oral Health. And prerequisites also are quite different. So you do have a little more, I suppose, flexibility or control, but you just need to make sure that in Year 12, 1 of your subjects that you complete aligns with the mathematics or sciences learning area. So important to understand those differences. What I'm going to do is sort of take you through an overview of the application process, the entry process for a domestic applicant for the Bachelor of Dental Surgery and the Bachelor of Oral Health. So this sort of timeline, if you will, all of these sort of key points in the process, it sort of follows a general sort of process of what a Year 12 student will experience sort of across their Year 12 from January to December. So I'm going to go through this as a top level and talk about, again, where the differences are with Bachelor of Dental Surgery and Bachelor of Oral Health. And then after this, we are going to break it down even further, and we'll go through each of these 8 steps in even more detail. So again, starting with the prerequisite subjects, already mentioned that this is something to be aware of even before you get to Year 12. Obviously, you need to make sure that you are on the right pathway to satisfy those prerequisites, whether it's Bachelor of Dental Surgery or Bachelor of Oral Health. Academic score, again, this is something to be aware of from the get-go in Year 12, keeping that at the front of your mind, making sure that you are working as hard as you know you can to make yourself as competitive as you can to get that sort of required score. More towards getting towards the middle of the year now, you will need to register for and sit the UCAT. So the UCAT is a formal part of the application process for both the Bachelor of Dental Surgery and the Bachelor of Oral Health. So you will sort of be able to choose. There is a testing period for the UCAT, again, in the middle of the year, where you get to choose sort of a date that best suits your schedule for when you would like to sit the UCAT. But you do have to be, again, in Year 12 to sit the UCAT. So if you're in Year 10 or Year 11, it's not something that you can do quite yet, but it's good to be aware of. Once you've done the UCAT, you will formally sort of apply, lodge your SATEC application to express your interest and desire to study either the Bachelor of Dental Surgery or the Bachelor of Oral Health with us, or both. So you do that through SATEC. SATEC applications will open. You'll jump in, sort of complete all the information that you need, list all your details, and list the Bachelor of Dental Surgery, the Bachelor of Oral Health, or again, or both, somewhere in your preferences. After you've done that, after SATEC applications close, we sort of step back and we look at all of the applicants that have applied to us in sort of both programs, and we assess who is eligible for the next step of the process, which is the interviews. So we will look at sort of the quality of all of the applicants, and we will advise you if you are successful in achieving an interview, in gaining an interview. And then obviously the next step is for you to actually sit that interview. So again, we're getting towards the end of Year 12 now, more towards sort of November, December. There is an interview period where you will again have that interview. Once that interview is completed, we step back again, and that's when we assess. We have everything that we need to look at in order to determine who ultimately will be made an offer. So again, let's break it down even further. I know that's a lot of steps. But there is a lot of sort of key pieces of information to be aware of with something like the non-standard admissions process that both degrees have. So step one, prerequisite subjects again. Dentistry, the two categories, one from either chemistry, physics, specialist maths or maths methods, and then one from chemistry, physics, geology or biology. And same thing, oral health, just one, making sure you've got one subject in there that aligns with science or maths as a learning area. And again, like I said, this is something to be aware of. If you're in year 10, if it's chemistry that you're most you want to do, you might have to do chemistry in year 10 and year 11 in order to be eligible to do it in year 12. So thinking about this now before you get to year 12 to make sure that you are on the path to being able to satisfy those requirements. Academic score, again, keeping this in the forefront of your mind. So same thing for the Bachelor of Dental Surgery, 90 or above as your ATAR. Just noting that that is including any applicable adjustment factors that you're eligible for. So your score sort of needs to be at a 90 or above as a total. If you're working towards the IB, again, a score of 34 or above. If you are interested in using your grade point average or your GPA as a higher education transfer or a higher education applicant to transfer essentially from one program, another program at the university into the Bachelor of Oral Health or into the Bachelor of Dental Surgery. This is where the GPA comes into play. So again, if you don't know, GPA is a score that you get when you are a university student. It summarises your performance across all of your marked assignments and exams and things like that. As you can see, to be eligible for that pathway for the Bachelor of Dental Surgery, you need a GPA of 5.0 or above. Oral health, again, differences, making sure you've got that 70 or above as an ATAR, 25 or above for the IB. And if you're interested in that GPA pathway, it's a 4.0 or above. So again, keeping all that in mind, you get to the point where you'll register for and sit the UCAT. Again, UCAT is a formal part of the process. The only sort of applicants that are excluded from needing to do the UCAT is our Aboriginal and Torres Strait Islander pathway applicants. So if that doesn't apply to you, it is something that you need to do. It is something that you need to be aware of in year 12. Again, you need to register for that. You need to sit it. The time, the period of time, the testing period this year for students that are interested in studying in 2024. As you can see, this year it is between the 3rd of July and the 11th of August. So you've got that sort of period to choose to sit the UCAT within that period of time, again, at a point in time that best suits you and your schedule. Again, once you've done that, SATEC application time. So you can jump in, log in, list everything that you need to complete that application. And again, just noting that obviously the Bachelor of Dental Surgery and the Bachelor of Oral Health are separate programs. So therefore, of course, they have separate SATEC codes. So they need to be listed. If you are interested in listing both in your preferences, they need to be listed separately. They will take up 2 of your preferences that you get. Right, once you've done that, once SATEC applications close, again, we go back in and we look at who is eligible to receive an interview. So the way that we determine that is we look at your UCAT score. That score is what determines whether you will progress through to have the interview. And as you can see, the 24th of October. So again, we're getting towards the end of the year now. 24th of October is when you will find out whether the outcome of your interview eligibility, so whether you have been successful in getting an interview. So that is communicated to you via email, and it will be sent to the email address that you put on your SATEC application, that you sort of completed your SATEC application with. So 24th of October, make note of that date, make sure that you're looking at your emails on that date to see if you are successful. Next step, obviously, is to do the interview. So again, there are some key differences here between the Bachelor of Dental Surgery and the Bachelor of Oral Health. So with the Bachelor of Dental Surgery, we will interview approximately, give or take, 300 applicants from the pool of the total applicants that we receive. 300 will receive an interview. For oral health, as you mentioned, smaller cohort, we will interview approximately 90 applicants of the pool of applications that we received. And again, there is one interview period for both the Bachelor of Dental Surgery and the Bachelor of Oral Health, just one period from sort of late November through to December at the end of this year. And so that usually is scheduled after your final sort of exams that you have to do in year 12. So really, really important things to note. Another important thing to note is that for the 2024 intake, if you're applying this year in Year 12 this year, applying to start studying next year, interviews will be conducted online via video conferencing. So just, again, keep that in mind. Once we got to that point, again, we're at the end of the year now. Our interview period is over. We've had all the interviews that we need to have. We will sit down and sort of figure out essentially who is being made an offer, who is successful. And again, we have everything that we need at that point. We will see your UCAT scores. We will have seen your performance in the interview, and we will have at that point received your overall academic score. So we assign a slightly different weighting to each of those three components to determine who will be given a place. So as you can see, your UCAT score is weighted at 20%. Your performance in the interview is weighted at 40%, and your overall academic score is weighted at the other 40%. And this applies to both the Bachelor of Dental Surgery and the Bachelor of Oral Health. And then if you are a successful applicant, if you've been made an offer, you will be notified via SATAC in the offer rounds, which generally will happen in December. Very exciting time. So key dates, assigning dates to all of that information that I just went through. So I suppose as we're in May now, the next date for you to be aware of is actually tomorrow, Wednesday the 17th of May. That is the UCAT registration closing date. So if you are in Year 12, if you are interested in sitting the UCAT this year to gain entry into one of these programs and you haven't registered for the UCAT yet, make that be the first thing that you do when you go home. Jump online and register for it, pay for your application, because again, they will close tomorrow. There are a couple of late deadlines, as you can see, but they do come with late applicant fees. So if you want to avoid that, if you're sitting it this year, make sure that you've registered for it as of tomorrow. Again, that period, 3rd of July through to the 11th of August, you've got the freedom to sit it at some point within that time frame. Monday the 7th of August this year is when the date that SATAC applications will open. So that is the date where you will have access to jump in and complete that application. Next key date to be aware of, this is a really, really important one, is Friday the 29th of September. That is the SATAC application closure date. So we do have a hard closure date for both the Bachelor of Dental Surgery and the Bachelor of Oral Health. There's a hard closure date, we cannot move it. Given they both programs have a non-standard admissions process, there's extra things that we have to look at, extra things that we have to assess. We close the SATAC applications quite a lot earlier than perhaps other programs. So really important to be aware of that. Make sure that you have lodged your application by the 29th of September if you are applying this year, and you have paid for your SATAC application by that date as well. Be mindful of that. Next date, 24th of October, again, that's when you will receive word whether you have been successful in gaining an interview. Then you will sit the interviews sometime between November and December, and then you will be notified if you've been made an offer in December. Right, so that was a lot of information in quite a short space of time. But the really good news for you is everything that I just said is written down for you in our dental surgery and oral health admissions guides. So the Faculty of Health and Medical Sciences puts these together. They are updated as they need to be every year. So this is a really, really good place for you to go back to and refer to. Again, everything that I said is written down for you to refer to in these guides. Everything and more. There is a lot of information in these guides, and I do highly, highly recommend that you check in with it, not just if you're in Year 12, if you are, again, earlier on, if Year 10, Year 11, check in with it. Make sure that you are on track for everything that you need to be doing. If for whatever reason anything changes to the application process, this is where it's going to be communicated to you. So make note of it. If you scan that QR code on the screen or jump on that website that's on the screen as well, that'll take you to the guides. Otherwise, you can jump on our website in the search bar at the top, search for dental surgery or oral health admissions guide. So really, really important documents to be aware of. The last thing that I will talk about before we jump into our Q&A session is Open Day. So Open Day this year will be held on Sunday, the 13th of August. We're very, very excited. We will be opening up the North Terrace campus. We will be also opening up the Adelaide Health and Medical Sciences building, which is also on North Terrace, but a little bit further, if you're not aware, a little bit further down next to the Royal Adelaide Hospital. And that is a key building for oral health students and dental surgery students. So we're very excited to be able to open that up and give you the opportunity to see those facilities. So again, if you're not already considering it, I highly, highly recommend that you do consider attending Open Day. It's a really fantastic way for you to network and connect with current students that are going through the program, meet your academics, your teachers, people that will end up ultimately being your teachers in the program. Just a really good way for you to start to visualize and picture what your experience will be like here at the University of Adelaide, what your life will look like as a University of Adelaide student. All right, as I invite my panel members to come up the front and take a seat, what I will sort of explain and preface this, please feel free up here, wherever you like. I will just preface this by saying that we are going to answer general admissions queries and questions that you might have, general questions that you have about the program, student experience, support, things like that, facilities, anything like that you would like to know. If you have specific questions about, things that relate to you personally and your personal circumstances, what I would recommend that you do is actually direct your questions to our Future Student Inquiries team, so you can get in contact with them via the website that's up on the screen or the email address. They are the best people to chat you through, again, any of those specific details or any specific issues that you might have. But again, if you do have a question, I just ask that you simply raise your hand and we will find a microphone to come to you. If there are no questions to begin with, while you're pondering all the questions that you can ask, I actually have a question for our current dentistry students. I'm wondering, I suppose, the dental surgery and oral health, they're both, it's quite a commitment to studying. You've got 3 years in the oral health and 5 years in dental surgery. So I'm wondering, what were your motivations behind wanting to be in the dental program? What were you, what interested you in it? What made you passionate about it to ultimately apply?
So hi, my name's Samantha. I'm a 4th year dental student. So for me, I've always really liked problem solving. I've always liked science, and I really like working with my hands. So a lot of my hobbies were crafts, including like crocheting, knitting, just drawing, doing things with my hands. And I wanted to be in a degree where I could do that every day, but also be able to problem solve and to continue to study science, the human body, and to be able to talk to patients. So for me, I think it was just a lot of what I already liked and what I had interest in. It aligned with what a lot of dentistry had to offer. So for me, it was a very easy choice to do dentistry. And coming in, doing this every day of my life, working with my hands, seeing patients get results from things that I've done, it's just very rewarding, and it's definitely motivated me to continue every day.
Hi, I'm Isabel and I'm in my 3rd year. I would say when I was in year 12, I really didn't know what I wanted to do. And what I saw in dentistry, my father is a dentist, was that it was a very, firstly, immediate gratification for a lot of patients. I didn't realize how important oral health was to people until I went into his surgery and saw the impact he had for patients. And my whole idea and framework of thinking in year 12 was I want to be able to help people. So at that time, I was looking into doing economics. That was my backup degree. And then I realized that if I went into economics and public policy, a lot of my things might get rejected after 8 months or years of work in 2 minutes in the government. And whereas in dentistry, I can help people and I can do those things. And I can also still look into economics and still look into public health, which is something Samantha and I are both doing as well. So yeah.
Hi guys, I'm Valerie. I'm in 2nd year, and Sasha, the question you've given us is actually kind of an interview question, but I won't give my interview answer. I'll just be honest with everyone. So what got me into dentistry? So I actually did a lot of debating in high school, and my parents thought I was going to be a lawyer, and I also did a lot of chamber choir. So what do those 2 things have in common? You have to open your mouth out like wide, right? Open wide, everyone will see your teeth. But the thing is, I had a lot of issues with my teeth. So they were really far apart, and I had something called a peg-shaped tooth. So it was like a really skinny tooth, and I got bullied a lot for it, and it really ruined my self-esteem. And when I talked to my parents about it, they kind of just were like, oh, we'll just fix it when you're older. We'll get you veneers or something. And I just still struggled with it so much. And when they took me to the dentist, it was my orthodontist who actually understood me. And instead of trying to comfort me like other adults would, he kind of just like went to the facts. Like he was like, "Oh, we'll fix it for you. Don't worry about it. We'll get it done." And that kind of really changed my perspective about what dentists do. And throughout high school, I was kind of considering, well, will I really find joy in doing law? Don't get me wrong, it's not a bad degree. But I started shadowing my dentist during the COVID period. And even though like there were so many issues about quarantine and all of that, he still committed so much to helping his patients, and he let me shadow him. He was so passionate not only like helping patients, but letting other people learn from him as well. And that really inspired me to get more into dentistry. And I listened to a lot of podcasts about dentistry, and I was like, wow, this sounds right for me. And then, yeah, here I am.
Fantastic. Thank you so much for sharing that, your perspectives and that experience. Again, if there is any questions, just simply pop up your hand and we will find a microphone to come to you. Oh, thank you so much.
I do have a question that's come through online here. So someone has asked, can you transfer between oral health into dentistry?
It's an interesting question. Sorry. I'll be the runner, sorry. I'll let you,
So something that we just want to clarify for both our programs. So both dental surgery and oral health have school leaver applicants as well as tertiary applicants. Okay, so we don't only take our domestic and international students just from year 12. So we have in both our programs students who come from complete university degrees or partial university degrees or other experiences as well. So the two programs are, whilst we're all in the dental team and we all work together in the field of dentistry, the scope of practice of a dentist and an oral health therapist is slightly different, and there is no internal transfer. You can see from the discussion before, our programs are sort of quite different in terms of entry requirements, length and scope of practice in terms of what a dentist does and an oral health therapist. So if you're interested in both, because a lot of our applicants are, like they, quite curious about the profession in general, you can certainly apply for both. But there is no internal inside transfer from, oral health to dentistry.
Yep.
We do have a number of our graduates that actually go and do work for a couple of years after they graduate, and then might apply separately as an entry to BDS. It's not a graduate entry, but they can use their score that they got through the university as part of their entrance as well. But as Dimi said, it's not an internal, but it happens at various times. Sometimes it happens through the program, but generally it's once people have graduated, had a little bit of experience, and they'll apply as a graduate.
I think that's very well summarised, very well said. And that is also where, again, that GPA score will come into play. So if in that case, if you've completed a degree and you're okay, I've spent a little bit of time out, I do want to go back and do, say, Bachelor of Dental Surgery, your GPA, you will still have a GPA from the time that you did complete whatever degree it was that you completed at university. That is the score that we will look at as your academic score. And again, so it's just making sure that you have met that minimum requirement, which for the Bachelor of Dental Surgery is a 5.0 or above. Any other questions from the crowd? Down the front. Thank you.
What adjustment factors apply for oral health and Bachelor of Dental Surgery?
It's a good question. I take you were here for the medicine session, so it's slightly different for Bachelor of Dental Surgery. I'll take this one if that's okay, if you have anything to add. For Bachelor of Dental Surgery and Bachelor of Oral Health, you will be considered for both subject-based points. It is possible to subject-based points and equity-based points, so that exception is different to the medicine program. Does that help? Anything you want to know? Summarise, great. Any other questions from the crowd? All the way out the back there, yes. Thank you, Nadine.
I was just wondering, for someone who's differentiating between oral health and dentistry, what do you think is a factor that I could take into consideration when choosing between oral health and dentistry?
It's a really good question. I might perhaps,
That's a very interesting question. Some find it very difficult to choose between, and that's why they will apply for both. I think it's really important to go and find out exactly what you do in both of the careers, because there are very similar components, but there are also very different aspects to it. So I would encourage anyone that is really looking at what your options are to make sure that when you go and do some visits and talking to different people, talking to students, talking to people out in the field, that you really know and ask the questions about what the difference is. There's lots of different terminology. So we've got dentists, we've got people that are hygienists, people that are dental therapists, people that are oral health therapists. And then there are dental assistants or dental nurses. So there are a range of different people. And to really understand what they do and spend time talking about that will be really important to help you understand.
And just adding to that too, so sometimes we hear it's quite difficult to actually shadow what Valerie was talking about, or shadow, or actually go into a dental surgery, or both in private or public practice, to actually observe. But there's other ways that you can get that same experience. Even start with your local dentist or your own dentist or dental practitioner, like if they work in a team, and see if you can talk to you over the phone. As Valerie said, there's podcasts, there's videos on the web that talk about the whole range and breadth of the dental team. And as Jen mentioned, it's really important to really understand the terminology of the different members of the dental team. That an orthodontist is a dental specialist. They are not a general dentist, although lots of general dentists do continuing education and also do orthodontics. So it's really important to find out what a general dentist does, like on a day-to-day basis, why they chose their careers, what they like about their career, and same with oral health therapists, to really find out about what is entailed in a career in oral health therapy, what's different about dental therapy, dental hygiene, working in public practice, private practice. Yeah, and some of that you can just obtain just from, the web itself. So if you don't actually obtain, physical experience, it's okay. And there is a dental assistant sort of workforce shortage. So some of our graduate applicants have, worked as dental assistants before coming into, applying to the programs. And they get a real insight. They sort of get hands-on experience working in that dental area.
Was there another question in the middle there? Yeah, sorry, up the back, just in the middle.
Is there any limitations on the UCAT, like the attempts you can give on, or what?
Is there any limitations on
the UCAT, like the exam?
Oh, limitations, like as in limits on the amount of times, yeah? So you can sit the UCAT once per admissions cycle. So if you sit it once, say for example, if you're in year 12 looking to gain entry in 2024, start studying in 2024, so you sit the UCAT this year, you're not successful in gaining a place, you can resit it, but you would be looking to gain a place in the following intake, the following year. You do need to redo it for every time that you are looking to gain entry. Scores, unfortunately, are not carried over from previous admission cycles. So no, there is no limit per se, but you do have to essentially, your score will be wiped clean and then you will redo it for however many times you're looking to apply. Essentially, is anything to add? No, great. Any other questions from the audience? While we may be thinking, I did actually have a question that I wanted to pose. I wonder if, coming from school as a school leaver, I think even not as a school leaver, as a higher education applicant, it can be quite daunting sometimes to go into perhaps a program like the Bachelor of Dental Surgery and the Bachelor of Oral Health. It can be, there's a lot of learning that you do and a lot of experience that you gain. And I wonder if you can talk to maybe the support that our students receive throughout the program.
I'll start. So I think that the first thing to do is what everyone's said, is to really find out what you're getting yourself into. I think that's the first thing. If it's something that you want to do, you're going to do well on it anyway. But having said that, we've got some fantastic staff within the school itself. I'm the dean, but I'm very proud of the fact that we've got a great team of people, academic staff. I'm not lying, am I? Who really want students to be successful. So there's a lot of opportunity throughout the program to get a lot of detailed feedback from the staff. So it's not like you'll be thrown into things unprepared. You'll be make sure that you're very well prepared before you go into things like clinics, which can be quite stressful at times. But also you'll get that feedback and things throughout the program. Yeah,
it is a really supportive environment. I think there's a lot of support services within the university. It's intense in these programs. You're almost full-time for a number of the years. So you're Monday to Friday, almost 8:30 to 4:30 every day. So I know in previous groups we've talked about the work that you can do. So you add on doing some work so that you've got some income. And that's really intense. So the university provide a lot of resources to help support you, but so did the staff. As Prof Logan mentioned, the tutors provide a lot of support and feedback, so that you're not left sort of with no feedback and then you get your grade at the end. You get feedback almost every session you're in the clinic, and we work a lot in small groups because you're with patients. We don't have one tutor to 25 when we've got patients there. So it might be that it's one tutor for about 5 to 6 students. So it is fairly supportive environment in that way. But it's good to have a supportive environment at home with friends or family that can help you, or colleagues, or if you've got other support people, if you don't have family here, is really important to make sure you've got a balance between your study and your outside life, because we do encourage you to have an outside life. Otherwise you get a little bit focused on what you're doing, and sometimes just being able to get away is really important.
I'll just hand over to the students because they can tell you about the Adelaide University Dental Students Society and peer support.
Yeah, so I agree. The staff is really great. Yeah, it's true. But also it's good with our students because we have our own society, and it's the Dental Society. The best part about it is we get together pretty often to socialise, to learn from one another. And it runs through all 5 grades. So I think a lot of the support I've been getting welfare-wise would be from seniors who have gone through exactly the same thing. So it's hard for, I guess, my family and my other non-dental friends to understand exactly what I do on a day-to-day basis, and to understand why I'm so stressed about uni, about going to classes, because our degree is really not exactly the same as other courses. But seniors, they really understand it because they went through exactly the same thing the year before. So being part of that society, or just even being part of those groups, or seeing people from other grades, really helps you put things into perspective. And they'll give you tips, they'll help you out academically. So you're really not alone. You have a lot of support within just the students and your own peer group.
Yeah, I would say when I actually moved to Adelaide to study, I stayed with some 5th year dental students for my first year, and I was in first year and with these 5th years, and they really helped me. But they also connected me with upper years as well. So I met Samantha in first year as well. I actually talked to Val when I was in first year, and Val was looking into doing dentistry. And so I think in all my years of dentistry, it has been the whole community of dental students, but then also having the tutors there who support us really well, who challenge us really well. I think oftentimes every time I'm in clinic, a tutor will ask me a question where I go, let me go back and research that for you and come back to you, because that's what being a clinician is, learning consistently and forever, I guess. So,
Yeah.
I think Samantha and Izzy pretty much summed it up. Adding on to what Samantha said about the Dental Society, so we call it the AUDSS. We actually have a mental health workshop coming up. I think it's next week on Thursday at the Adelaide Health and Medical Sciences building. So like we get, quite often we get like professionals to come in, or like existing dentists, or even physiotherapists to talk about like how you can take care of yourself physically and also mentally within dentistry. Yeah.
It's a great way to promote what sounds like a really fantastic event.
And just the last thing.
No.
I think, so we talked about stuff within the school. There's also a lot of university supports outside and within the university as well. So that's important.
Absolutely, yeah. More broadly, beyond, I suppose, the Faculty of Health and Medical Sciences, there are many resources. Again, it is the second that you put up your hand and you say, I'm struggling with something, I need help, there are all of these services that you can access. You don't necessarily have to sit there and struggle alone. So if there are no more questions from the audience, one last one, you got in just in time. We'll make this the last one. Thanks, Nadine.
What's the ideal UCAT score to get into dentistry?
It's an interesting question. So I will take this one if that's okay. So in terms of UCAT score, like you saw on the slides, your UCAT score is ultimately what determines whether you are given an interview. So we don't necessarily have an ideal UCAT score. There is no cutoff. It's not something that we advertise because it's not actually relevant per se. We look at the performance of everyone's applicants, all of the applicants in that year, and we look at the top performers of that year and we progress them through. So last year's, top performer, the UCAT score may not necessarily be the same because it is based on the performance of every cohort, every round of sort of applicants, if that makes sense. So there isn't necessarily an ideal UCAT score I can communicate. All right. If there's no more questions, we'll wrap it up there. I would like to thank you all again for your time this evening, for coming along. We hope that you found that enjoyable and informative. And I'd like to also extend my thanks to our panelists for spending your Tuesday evening with us. And I suppose we wish you all, on behalf of the university, we wish you all very, very, very best of luck in the rest of your school journey, regardless of what point that you are in. All the best with your applications if you do choose to apply to study with us, and hopefully we will see you on campus at some point in the future. Enjoy the rest of your evenings. Thank you so much.